Dr. Jeff Harp from Highland Family Medicine is back after a little break. Good to see you back here.
Likewise.
All right, so today we're talking about hospitalists. All right, we use this term. What are we saying? What are they?
So a hospitalist is a physician who specializes in taking care of people inside the hospital. Maybe a little bit of history here. Probably a generation ago, 25 years ago or so, many primary care physicians followed their patients when they went into the hospital and would see them every day and supervise their care. These days, most primary care physicians are concentrating on their outpatient practice, and it's just easier for them to transition people into the care of a hospitalist, a person who practices only in the hospital when the person needs to be hospitalized.
Okay, and so what kind of impact is there on the patient then in this scenario?
Well, there's a couple of things. First of all, there's a lot of advantages. Hospitalists specialize in taking care of people who are in hospitals, and so tend to be more seriously ill than somebody who's walking into a doctor's office. So they take care of diabetes out of control, heart failure, kidney failure, serious infections, things that outpatient physicians don't have as much time or experience to work with. So they work in teams. There's oftentimes nurse practitioners, physician's assistants, residents working along with them, and they're in the hospital 24 hours a day. So, you know, they're not distracted going off to their practice to take care of outpatients, and so they can be available as things change.
Okay, the flow of information here obviously is key when someone is in the hospital. How does it impact that?
So that's probably the biggest potential pitfall, is that this person taking care of you in the hospital doesn't know you as an outpatient.
Yeah.
So there needs to be work done to make sure information is transferred from one place to the other.
Okay. I was going to say, and I guess that's how you sort of try to overcome that, is, as a patient, try to be proactive in this scenario, right?
That's right. So it's important when you're working with a hospitalist to explain to that person, especially anything unusual about your history, unusual operations or reactions or diseases, and say, you know, this is in my background. Please figure out what that means for what's going on right now. Maybe even encourage a hospitalist to get in touch with a primary care physician, or ask the hospitalist if they have access to your medical records. You know, can they read through things and figure out your history enough so that they can take good care of you in the hospital.
All right, so the good news, we get better, we leave the hospital. How does all this kind of flow back into our primary care setting?
Right, so hospitalists put together a summary of what happened in the hospital, tests, x-rays, procedures, and even recommendations about how to follow up after the person leaves the hospital. So that should be in a packet, a piece of paper that you're given when you leave the hospital. People should take that to their primary care physician and then ask the hospitalist, what are the most important things to tell my outpatient doctor? What are the things that need to be done next, so that the patient can kind of coach their primary care person in what needs to happen.
All right, we'll leave it there. Thanks, doctor. Good to see you.
You're welcome.
So that's the summary on hospitalists. If you missed any of our conversation, we'll share it online as well at rochesterfirst.com.